Hello, dear viewers. I'm Dr. Sarah Whitmore. Today, we're going to shed light on a topic that puzzles millions of men, but is often only whispered about. How much does your sex life change as you age, and how should you cope with these changes? And believe me, what you're about to learn will surprise you. You might even question everything you've believed to be true for years. Let's start with a question. Are you ready? Did you know that more than half of men in their 70s are still sexually active? Yes, you heard that right. Moreover, most of these men state that they have their best, most satisfying sexual experiences during this period of their lives. Surprising, isn't it? So why then do most men approach their sexual health even after the age of 60 as if they were still 20 years old, and how does this actually harm them? Today, we're going to unravel this mystery. We'll discuss, step by step, the true science of how your body evolves after 60, why youthful approaches no longer work, and most importantly, what you should do instead. If you're over 60, or if there's a man in your life who is, this video could completely transform your understanding of sexual health. This isn't a place where we talk about miracle pills or instant solutions. This is a place to understand your body, embrace its natural evolution, and learn how to work with it to improve your quality of life. Let's get started. Let's be honest, as you age, you've probably noticed that some things aren't quite as they used to be. Perhaps it takes you longer to get aroused. Perhaps you need more stimulation than before. Maybe you're thinking to yourself, is this the beginning of the end for my sex life? Well, here's the great news. Absolutely not. Everything you're experiencing is completely normal and even manageable. So, what's the problem? Is your body broken? No. The real problem is that no one has taught us how to adapt our sex lives as we age. As a society, we perceive even the slightest deviation from our 20-year-old performance as a failure. And unfortunately, this mindset only makes things worse. Let's scientifically examine what truly happens in your body after the age of 60. Testosterone levels. After approximately age 30, your testosterone levels begin to decline by an average of 1% per year. It might seem like a small percentage, right? But calculate it. By the time you reach 60, you've lost about 30% of your peak testosterone levels. The numbers get even more interesting. 20% of men over 60 and a full 50% of men over 80 have clinically low testosterone levels. Cardiovascular health. Your cardiovascular system also takes its toll. Due to the natural hardening of your arteries and the aging process, blood flow throughout your body, yes, including your sexual organs, isn't as efficient as it once was. What does this mean? Erections may take longer to achieve and require more direct stimulation. This might sound concerning, but don't panic. Understanding these changes is the first and most crucial step to successfully adapting to them and even making your sexual life more enjoyable. Think about it. Would you try to run a marathon at 65 at the same speed and with the same training as you would at 25? Of course not. You'd prepare differently, go at a different pace, and your expectations would be different. The same principle applies to sexual health. But most men don't make this simple adjustment. What was the old approach from your younger years? Speed, intensity, and immediate results. Rapid arousal, instant firm erections, very intense orgasms, and almost no recovery time. This worked wonderfully when your hormones were soaring and your blood circulation was at its peak. However, continuing to chase this fast and furious experience after 60, well, it's like pushing a luxurious, comfortable sports car to its limits as if it were a race car. What's the result? Frustration, anxiety, and unfortunately, often a complete avoidance of sexual activity. Many men view normal age-related changes as a sexual failure and give up. This is tragic, because with the right approach, your sexual satisfaction can actually increase with age. So, what should you do in this situation? The answer is actually very simple. Your body hasn't stopped working, it's just operating at a different rhythm. And when you adapt to this new rhythm, believe me, wonderful things can happen. 1. Change the timing. Discover the morning miracle. Did you know this? Your testosterone levels peak in the mornings, generally between 6 and 8 a.m. Your body is naturally most ready for sexual activity during these hours. So what do? Most men, out of habit, prefer to be intimate in the evenings when their hormone levels and energy are at their lowest. Just shifting your routine to the morning can make a dramatic difference in your experience. Try it. You'll be surprised by the results. 2. Lubricants. Not a necessity, but an enhancement tool. As we age, the natural moisture production in our bodies significantly decreases. This isn't just a matter of comfort. Insufficient lubrication can lead to irritation and even pain. It's time to stop seeing lubricants as a sign of deficiency. View them as an enhancement tool that will make your sexual experience more enjoyable and comfortable. Just like using glasses to see better, using lubricants helps your body function at its best. Water-based, silicone-based, even natural oil-based options, find the one that suits you best and witness the positive change in your sex life. Now let's talk about perhaps the most common complaint, which actually holds the greatest opportunity: arousal taking longer. This might seem frustrating at first, right? But it actually opens up brand new doors. When arousal takes longer, do you know what happens? You have more time to explore different touches, new areas, and varied sensations. When your orgasms are perhaps less intense but longer lasting, how do you feel? You can experience a more continuous, deeper pleasure. When your recovery time increases, that's not a problem. On the contrary, you can focus more on intimacy, emotional connection, and sharing with your partner between sexual encounters. Men's health experts are receiving incredible feedback from their older patients who embrace this slower approach. Many describe it as revolutionary. Experts like urologist Dr. Stefan Buntro emphasize that the use it or lose it principle applies strongly to sexual function as well. In other words, staying sexually active, even if your patterns change with age, is key to maintaining your overall sexual health. Remember, while a younger man might reach full arousal in minutes, a man over 60 generally needs 15 to 30 minutes of arousal. This isn't a problem. It's a new reality you need to embrace. Instead of seeing this extended time as an obstacle, think of it as an opportunity. It offers more chances for exploration, greater variety in touches and techniques, and the ability to form a deeper connection with your own body's responses. Believe me, once you stop rushing and start enjoying the journey, you'll discover sensations and preferences you never knew existed. Sexual activity and prostate health. Now, I'm going to give you perhaps the most important piece of information in this video. Please listen very carefully, because this information could change your life. Sexual activity provides incredible benefits for your prostate health. Have you heard of the Harvard Health Professionals follow-up study? They tracked over 29,000 men for decades and made an incredible discovery. Men who ejaculated 21 or more times per month had a 31% lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. This was not a small or short-term study. Nearly 30,000 men were followed for years, and the results were surprisingly consistent and significant. Australian researchers also confirmed these findings with their own large-scale study, showing a 36% risk reduction in men who maintained regular ejaculation frequency. This protective effect seems to work by helping to flush out potentially harmful substances from the prostate gland and reducing inflammation in the prostate tissue. What does this mean? It doesn't mean you need to ejaculate as frequently as you did in your youth. It means that regular sexual activity, whether with a partner or alone, provides measurable health benefits that go far beyond just pleasure. So, you're not just maintaining your sexual health, you're actively protecting yourself against one of the most common cancers affecting men. Amazing information, isn't it? The benefits of maintaining sexual activity aren't limited to just your prostate. It's a whole body health prescription. Heart health. Sexual activity provides cardiovascular exercise equivalent to climbing stairs or brisk walking. Research shows that sexually active older men have lower inflammatory markers in their blood, better stress hormone profiles, and a lower risk of cardiovascular events. Better quality sleep. A full 54% of men report better sleep after orgasm. Thanks to the release of hormones like oxytocin and prolactin, it acts as a natural sleep aid. For men over 60, especially those experiencing sleep issues, this can be an incredibly valuable solution. Stronger immune system. Moderate sexual activity. 1 to 2 times a week is associated with higher levels of immunoglobulin A, IgA, an antibody that protects against infections. It's as if regular sexual activity tunes up your immune system to work at its best. So, how do you apply all this information to your life? The key word is adaptation, not abandonment. You're not giving up on sexual pleasure, you're simply evolving your approach to match your body's current capabilities. Make your environment comfortable. Comfort becomes crucial as you age. Find positions that don't strain your back, neck, or joints. Use pillows if necessary. If you have movement limitations like arthritis, explore techniques and positions that work with them, not against them. Embrace the mental aspect. The mental dimension of sexuality becomes even more important with age. Performance anxiety can affect 20% of men between 75 and 95. 2. Break this vicious cycle. Shift your focus from performance to pleasure. Concentrate on what's happening and how you're feeling. Stop comparing yourself to your past performance and appreciate your current capacity. Many men report that their sexual experiences actually improve with age as they gain better communication skills and confidence in expressing themselves. Communicate openly with your partner. If you have a partner, communication is more vital than ever. Both of you are exploring changing bodies and evolving desires together. Instead of accusatory statements like, "You never want to," use I statements such as, "I feel a bit disconnected and I'd like to explore ways we can be close." This reduces defensiveness and paves the way for constructive conversations. You might even consider having regular check-ins about your relationship and intimate life. This might not sound romantic, but for many successful long-term couples, it's the foundation of romance. Broaden your definition of intimacy. Remember that elements beyond intercourse, such as massage, extended foreplay, sensual touch, and deep emotional connection, can be just as, or often more, satisfying than intercourse itself. This broader understanding of intimacy reduces pressure on performance and creates more opportunities for connection. Not every change in sexual function is solely due to aging. Many men don't realize that problems they consider inevitable are actually treatable. Please pay attention to the following situations. Sudden changes in sexual function, especially if they occur within weeks, not over years, should be evaluated by a healthcare professional. If you experience chest pain during sexual activity, seek immediate medical attention. While sexual activity is generally safe for healthy hearts, it can be dangerous for those with certain heart conditions. Persistent erectile dysfunction can be an early warning sign of cardiovascular disease. The blood vessels supplying the penis are smaller than those supplying the heart, so circulatory problems often manifest in sexual function before becoming apparent elsewhere. A severe decrease in sexual desire, especially if accompanied by depression, fatigue, or other symptoms, could indicate low testosterone or other hormonal imbalances that can be treated. Blood tests can determine if hormone replacement therapy or other treatments might be beneficial. Regarding testosterone replacement therapy, yes, testosterone naturally declines with age, but only about 10% to 25% of older men have levels low enough to require medical treatment. The important thing is to have both symptoms and confirmed low levels through blood tests. Remember, many men can support natural testosterone production through lifestyle changes such as regular exercise, especially strength training, adequate sleep, maintaining a healthy weight, and stress management. What we're discussing here goes beyond just sexual function, my dear viewers. We're talking about maintaining vitality, connection, and the joy of life during the aging process. Sexual health is inextricably linked to your overall health, mental well-being, and quality of life. Research consistently shows that men who remain sexually active, maintain intimate relationships, and still see themselves as vital and capable, have lower rates of depression, better cognitive function, and generally live longer than their peers. If you've been avoiding sexual activity because things don't work the way they used to, I hope this information has made you reconsider. Your body hasn't broken down, it has simply evolved, and with the right approach, this evolution can lead you to brand new forms of satisfaction and connection. Start slowly, be patient with yourself. If you haven't been sexually active for a while, don't expect everything to work perfectly right away. Just like any physical activity, sexual function improves with practice and regularity. And one final reminder, Never hesitate to talk to a healthcare professional about your sexual health. Many people feel embarrassed or think nothing can be done. But believe me, many effective treatments are available, and your doctor can guide you through this process. Remember that sexual satisfaction isn't just about physical function. Emotional connection, communication, and mental engagement are equally important components of a fulfilling, intimate life. And many of these aspects actually improve with age and experience. I hope this conversation has opened a new window in your life. Remember, sexual wellness isn't about regaining your youth. It's about understanding, embracing your current capabilities, and optimizing your health and satisfaction in the best possible way. Don't forget to share your thoughts and questions on this topic in the comments. If you haven't subscribed to my channel, please do so and turn on the bell to be the first to know about new videos. See you in future videos. Stay healthy and happy.